Hello, everybody. I think we can start. Welcome to the first ECHOS webinar. ECHOS stands for Establishing of Cancer Mission Hubs, Networks, and Synergies. My name is Marius Geanta. I'm the founder of the Center for Innovation in Medicine, one of the partners in the ECHOS project, and we are leading one of the work packages. And as I mentioned, this is the first webinar in a series around missions, why a mission in health, and why EU cancer mission. So these are the topics we would like to discuss today. And I think we have the right person to kickstart this series of webinars in the person of Professor Christine Chomienne. Hello, Christine. Christine is the vice chair of the Horizon Europe Cancer Mission Board Phase 2 and was as well part of the Cancer Mission Board Phase 1. So actually, Christine is from the beginning in the Cancer Mission Board and has already this understanding from the initiation of to the current status of the Cancer Mission implementation, and the right person to look into the future and to understand how we can all contribute to the Cancer Mission impact. So once again, thank you so much for joining us today, Christine.
Thank you, Marius. It's a pleasure for me once again, whenever I have the opportunity, to talk about the concept of the mission, the work of the Cancer Mission, and of course, what this implies for the future of the citizens, the patients, and all the stakeholders working on cancer to be able to bring solutions to this important challenge that we are facing and that, unfortunately, our children will be facing probably more than we are. So if I can have the first slide. Thank you. So as Marius said, I want to give you first a bit of background. Why did the European Commission set up the missions? Then I will summarize rapidly how we were set up, the process, right up to the implementation plan. Then I will give you some example of how this implementation is being developed, the role of the citizens in this implementation with a few highlights. And then I'll try just at the end to show a few thoughts on what the impact studies should be and should look like. And then, of course, I'll be happy to answer your questions and, of course, Marius' questions also. So the background. It started back in 2017. And it's going on now exactly in the same process in the program for research and development and innovation. There's always a moment of reflection to prepare the future program. And so 2017, they sat down, and it's Pascal Lamy's report, to identify what were the impression and evaluation of the program, which was called H2020. And they realized that the citizens did not see the impact of research and did not understand what we were doing for research and innovation. And so they thought that it would be important to create more impact through mission orientation and citizens' involvement. And that's how the missions were identified as a strong new way to program research and innovation for Horizon Europe. Next slide. So to be able to develop this mission-oriented research and innovation approach, it's a very specific manner of programming research and innovation, which has already been used in the economic world, but not so much in the scientific world that we are used to. And so the European Commission asked the Professor Mariana Mazzucato, an economist, to provide 2 documents that would show the European Commission how to set up the mission's approach and how to provide a tool to govern the mission in the European Union. So what are these missions approaches? Missions provide a solution, an opportunity, and an approach to address the numerous challenges that people face in their daily lives. The mission's goal is to involve citizens and stakeholders more closely in setting research priorities. But not only, as you will see, we need also to be able to link it to policy actions. And these will lead to equal access for everyone in Europe to the best of European innovation and research resources and global know-how. So these two reports, which are available, are very easy to read. And these are sentences that I like to be able to take from these two reports. Next slide. So the challenges that were identified by the European Commission were adaptation to climate change, cancer, climate neutral and smart cities, restores our ocean and waters, and clean soils and forests. Next slide. So we started to work in September 2020. The 5 missions had 5 mission board, and we were asked to give the recommendations to the European Commission, and these were delivered to our commissioner. In the cancer mission board, we followed the criteria of a mission concept. We need to have a specific targets, and so we had identified that we wanted to save more than 3 million lives. We have to give the timing of this target, and that was by 2030. But we also wanted to stress that not only did we want to save lives, but we wanted also to have the citizens and patients to live longer and better. To reach this goal, we identified 5 intervention areas: prevent what is preventable, optimize diagnostics and treatment, support quality of life for patients and for their carers, all this for all EU citizens, and we could not improve if we did not understand better all these measures that need to be developed. Next slide. And after our recommendations, as you know, the President of the European Commission also in parallel identified the need of having once again a Europe's Beating Cancer plan. So with these 2 opportunities, it was important for the cancer field. They were launched in parallel, the implementation plan for the European missions and the Europe's Beating Cancer plan. It was also crucial that we had the support of all the parliament's politics representatives. And we had the Becker Committee and my long past friend, Véronique Trier-Lenoir, who was the rapporteur of the European Parliament rapport on fighting against cancer. So all this, as you can see, is a very strong buzz that I think we are all very happy, because the impact of these 2 initiatives with the support of the members of the Parliament and the member states is really important for all of us. Next slide. So as you've seen, we work in parallel with the Europe's Beating Cancer plan. The mission on cancer is part of the Europe's Beating Cancer plan. It's a strong pillar both of the Health Union. The mission supports its implementation and creates a dynamic link between research and innovation and policy. It's crucial for the Cancer Mission Plan to have the Europe's Beating Cancer plan in parallel, essentially for implementing these policies, which is not in the remit of research and development. We generate knowledge and evidence in the areas of understanding, prevention, diagnosis, treatment, and quality of life. We're a point of contact with European citizens, and we deliver scientific advice on the overall implementation of the Europe's Beating Cancer plan. At least we hope so. Next slide. So this is where we are. These 2 reports that Mariana Mazzucato gave us, our recommendation in 2020 and in September of 2021, the implementation of how can these intervention areas and recommendations be delivered to be able to reach the goal. So I just want to highlight once again that missions connect all relevant actors through new forms of partnerships for co-design and co-creation by focusing on the targets that require multiple sectors and actors to solve. So it's more of taking a problem-focused lens and not a sectorial lens. So we have a question and we put everybody together who wants to answer the question, whatever the discipline. It's not one discipline who decides how they want to bring the solution. Thus, mission-oriented innovation has the possibility of leading to system-wide transformation. And as you know, transformation takes some time. Next slide. So coming back more now into our implementation. So the implementation plan, as you can see, the goal has been changed a little bit. This comes from the commissioner's input that saving lives is probably not in the remit of DGRTD. So it's to improve the lives of more than 3 million people by 2030 through prevention, cure, and for those affected by cancer, including their families, to live longer and better. And of course, the goal is jointly with the Europe's Beating Cancer Plan. We have 4 mission objectives in the implementation plan. You can see them once again: understanding cancer, prevention, early detection, diagnosis and treatment, and quality of life. So of course, this is very close to the recommendation of the first Cancer Mission Board. We also have transversal priorities areas: equity, innovation, childhood cancer, and of course, personalized medicine. Specific concrete actions have been identified in the implementation plan to provide and I'll come back to it a bit more, actions which are dedicated to data research platform, to a prevention center, to networks of comprehensive cancer infrastructure, a cancer patient digital center, of course, research and innovation for each of the mission objectives, and the importance, once again, of synergies between Cancer Mission and other initiatives, whether it's at the EU level. And for example, we are working not only with EU for Health and Digital Europe, but also at the national and regional and local level. We cannot work just with DGRTD. Next slide, please. So I will come more into how we set up this work and what are strategies for the implementation. So you can see in red, which is what I want really to focus on, is to be able to answer these 4 objectives. We have competitive calls. Once again, it's not an ethical research programming approach just by giving out money to people to do the work that we believe is the best. The ideas are out, but it's competitive calls which are selected. So we have competitive calls, but we do have, let's say, a new system which allows for a preference for childhood cancers if the scientific quality is identical to the other laureates. We have new funding synergies, new network. We stimulate a wide EU consortia for brainstorming, and we have developed surveys, think tanks, workshops and webinars to make sure that we identify where the gaps are, and we develop the interest and the skills of the community, which can answer these competitive calls and provide solutions. Next slide. So these, of course, don't go through all the slide, but it's just to show that these are not example of the competitive calls that are brought out every year since 2021. The mission board members have asked that all the 5 intervention areas are addressed every year. So it's not just 1 year quality of life and another year prevention. So we have a strong balance of calls for each of the pillars. And you will see for support of quality of life, for example, it's very much addressed to the participation of patients and citizens. We also have on the left for prevention, enhanced primary cancer prevention through sustainable behavioral change, where here again, the patients are really very much centered, and the citizens, of course. Next slide. So I would like to show two examples of what we call the brainstorming that is necessary to provide new initiatives, maybe new breakthroughs, which are the UNCAN EU platform and the European Cancer Patient Digital Center, which are 2 actions of the Cancer Mission but which are also flagships of the Europe's Beating Cancer Plan. The UNCAN EU, as you can see here on the left, is a federated cancer research data hub. For the first Cancer Mission Board, we were criticized by the patient organization, saying that there's so much data and so much information that was stuck in silos, and we needed a platform to bring all this knowledge together so that it was available for everybody, including the researchers. So the idea is to create a federated cancer research data hub, which are fed with research use cases to be able to prepare the field of how to collect, harmonize very good quality data. It involves patient advocates and EU citizens. And of course, the purpose is to solve inequities between member states to provide information to understand cancer. And so I would just highlight here the work package 4, where the general objectives of the projects are to ensure that cancer patients and their relatives have a central role and strong voice within the project activities while informing for UNCAN EU on European citizens' expectations. And the report, because the UNCAN EU platform is finished for the moment in its preparation phase, it has provided a blueprint of how they thought best to move forward. And the feedback from Work Packet 4 with the patients and the citizens were that they felt very happy to be involved very closely to the identification of the use cases and to what their feeling were on better understanding cancer and sharing data. Next slide, please. The other flagship I want to talk about is the Europe Cancer Patient Digital Center. It also was at the request during the first board of the patients, and it continues, and I will highlight it a bit more later on, of patients' feedback that they request more information about their disease, more access to their data, and to be able to participate in research if they want. And so this house summarizes a bit what we see this digital center to look like. The house needs to be adapted to each country and to each patient and each cancer, where the patient will find in his house, in one room, information and support, in another room, his access to his data so that he can manage better than sometimes his GP or oncologist, the last results, which he can have available in his house. There's also a room where the patient can have access to a tool to monitor and report everyday data, quality of life, prompts, sometimes to have the incentives to report how one feels and answer a specific questionnaire allows patients not only to realize that he is not alone in his questions, but also to increase his literacy. And then one room, if all this house has data, then if the patient wants, he can participate in research and share his data. So this also has been the work of a blueprint. The blueprint has been finished and the report is out there. And the call of this program for 2024 and 25 shows that we can continue the work on the UNCAN EU platform, the use cases, and the Europe's Cancer Patient Digital Center to finalize such an important tool. Next slide. And so these are the types of calls that I wanted to highlight. As I said, the way that we also need to implement the mission cancer actions is to receive feedback through surveys, but also through workshops. And so since 2023, DGRTD has brought together young cancer survivors, the AYA group, to be able to, through these workshops, to be able to provide recommendations of how to understand and manage, in particular, late effects in this specific population. And so, as I've said, it's one of the means that we have to be able to collect gaps, information, feeling, feedbacks, so that after that we can develop actions of research interventions and also to stimulate policy actions through the Europe's Beating Cancer Plan. There's actually now a new workshop which is being prepared on supportive and palliative care. Next slide. Thank you, Rabia. And I would like to highlight once again a French initiative during the French presidency where they brought together all the stakeholders to be able to define the Mission Europe and the citizen engagement. And so in the workshop that was dedicated specifically to the Cancer Mission Board, all the 5 missions had workshops. We identified clear statements of citizen engagement in the Mission Europe. And I've just highlighted the one which I think is more crucial because it's the one that Marius Geanta feels strongly about, and so do I. We do not need only to consult the citizens and the patient, but we believe that active participation to the co-construction throughout the lifespan of the action is crucial. And this was one of the statements that came out of this workshop. Next slide. So just another level. So these actions, the way that we try and work through the cause, through the brainstorming, the blueprints of setting out new structures, the way that we try to involve as much as possible citizens to understand their needs, but also to help them to work with us in the co-construction and co-monitoring phase. It needs to be implemented not in Brussels, but at the member states and at the local level. So it's very important that we have all these structures which have been set up at the member states level, which try to highlight not only the importance of cancer that has been implemented at the European Commission, that needs to be also implemented at the member states level, but also to be able to provide the incentives of the mission concept. And as you know, ECHOS, for which this webinar is a part of, is part of the set-up national cancer mission hubs, and ECHOS is there to work with the member states to be able to show how each member states can establish a cancer mission hub. Next slide, please. So I will come now to what I think is the most important, the most complicated. So where are we now? So I've taken back let's say the way that we program research and innovation through the mission approach. So we have missions. They've been established, and so they're there. I think, and I strongly believe, that we do have already stimulated multiple sectors and multiple forms of cross-actor collaborations to address these problems. We have identified some of these problems. So I've ticked the 2 boxes, right? What I've highlighted in the light gray of the sentence is the solution is then reached, right? So we've stimulated multiple sectors, and I still believe that there's so much work going out there since the last 3 years. It's time that we sit down to be able to see what is the best method to collect all the work that is being done, and to make sure that, of course, the solution is then reached, and then we will have, of course, reached our goal. Next slide, please. So how do we try and get the implementation measured? It's something that, of course, is required in each authority. that programs research innovation. It's a way of healthy working for any business. It's important not only to evaluate, which is a strong negative work, but to try to measure what is the impact of the actions of the business, of the program, of whatever. It's important to try and see how to do it. So as I've told you, we're Cancer Mission Board, and of course we work very closely with DG RTD at the European Commission and DG Santé at the European Commission. DG RTD at the European Commission is the commission, the DJ, which is responsible for the 5 missions and also for the research program Horizon Europe. And DG Santé is responsible for the cancer and, of course, the Europe's Beating Cancer Plan. So the words evaluation and monitoring are very close to the work that the European Commission has always worked. So there is an evaluation of the 5 missions, which is ongoing and being prepared. And in parallel, there's also the evaluation of the research program called Horizon Europe. At DG Santé level, there are monitoring processes of the Europe's Beating Cancer Plan, and of course, the evaluations of the Beating Cancer Plan. At the mission board, what we would like, and I think it's probably something that we can also discuss here all together and during the future webinars that are going to be developed, we believe that monitoring mission cancer actions require first assessing the progress of the cancer mission, mapping ongoing calls and actions with the cancer mission implementation, but also the Europe's Beating Cancer Plan. And we believe that the two need to be monitored at the same time. As I've said, some of our actions cannot be pure research and innovation actions and are also implemented into policy actions. What we believe is important is to have the feedback from the coordinators of the calls and the projects which have been selected in the Cancer Mission Program. We believe also that the assessment of the mission added value to the cancer challenge is crucial. It's not, as I've said, and I hope you've understood, a standard way of working for research and innovation. The mission concept is different. It was selected because it was believed to have an added value that was needed to answer a specific societal challenge that was cancer. And so we need to be able to show the added value of the mission concept. We also need to have a midterm feedback from the stakeholders. The stakeholders are all the people who have accepted and believed that the cancer mission could provide an added value, and this involves the patients and the citizens. And so we need to be able to provide to them, with them, what they would see as means to measure the impact of the mission and the mission concept. Once again, we cannot deceive them, and so we must be sure that we are working in the way that they wanted us to work. And so what I've said, which is important, is to be able to set the means at the national and the local level to measure the cancer mission goal, which is to improve the lives of more than 3 million people by 2030 through prevention, cures, and those affected by cancer and their families to live longer and better. So if you've ever done any research, I'm not quite sure that we have the tools to measure improvement. How do you measure improvement? So it's important in all measuring systems to be able to have, let's say, a specific indicators at the beginning, so that when we want to look at it at different time points, we can measure something that has moved, and hopefully for us, something that has moved in the right direction and improvement. Next slide, please. So where are we according to me? And I've put what I have in this slide for the moment. So work has started very officially, for example, by asking different types of tenders and external organizations to be able to provide already some evaluation of the 5 missions and monitoring of the Europe's Beating Cancer Plan. So there are already some documents which have been produced and published, which I highlighted here, both for the 5 missions and also for the Beating Cancer Plan. For mapping ongoing calls and actions, we are very happy now to be able to say, since a few weeks, that there is a Cancer Mission implementation webpage where you can find the information of the calls and actions, and the Joint Research Center has provided a means that visualize how all these projects can interact together. So we are on the way. As I've said already, it's difficult, which has been highlighted in the 2 official programs that have just been published for the 5 missions and the Beating Cancer Plan, is that, of course, it's too early to be able to measure an impact, once again, with the standard tools. However, the citizens, the patients, and the stakeholders, including the members of parliament, need to have more rapid feedback on the progress and the impact. And so therefore, it's urgent that we develop indicators right away that will measure the impact regularly, while waiting for 2030 to see a major change. And I strongly believe the sentences that to have feedback and to work from stakeholders is important to be able to answer right away what the stakeholders would like to see as impact indicators from today. And I think I'll open the floor now with Marius and all of you to be able to develop more on this important impact measurement, but also answer other questions that you may have. Thank you very much.
Thank you so much, Christine, for this overview. And as you said, we are now opening the floor for different questions from the audience. Please use the Q&A formulary or the chat in order to interact with Christine and myself. And actually, we have already one question, and I'll suggest to start with this one. Mission on Cancer and Europe's Beating Cancer Plan create some confusions still, and how do they relate to each other and the programs under it? So I think this is a question that came all the time.
Yes, it's a question that happens all the time, and I've just said a small sentence at the beginning. The mission approach is to provide a new way of solutions to answer citizens and patients' requests and needs. As you can imagine, and we see it when we talk with the patients and the citizens, their needs are usually seen through a policy action, a change in the policy action. It's not through a research and innovation action. They want the result of the research and innovation to be already delivered in the policy that will change their life and that will answer their need. So we do need, as I've said, in the Cancer Mission approach, which is in research and innovation remit, to be able to lean on an initiative, on an action that can deliver on the policy. And so that is why, as I've said, we are an advisory board for the Research Horizon Europe, but we are also an advisory board for the Beating Cancer Plan, and the Beating Cancer Plan DG Santé actors are present in all of the mission board meeting. So for us, it's not a confusion. Missions are under Horizon Europe and are therefore research and innovation action, but the mission concept needs to answer patients' needs, and relies on policy action, and therefore we need the Europe's Beating Cancer Plan. There's also the Green Deal and other actions at the European Commission, which also help the delivery of policy actions for the other missions.
Thank you, Christine. And I would suggest actually to stay B, because you mentioned many times the citizens and patients' perspective, needs, preferences as the core actually of the mission, and how important it's actually to capture this, to capture the broader scale, the societal perspective, and of course the stakeholders, but we'll discuss about stakeholders afterwards. So, and you mentioned that with the mission, we do not have the traditional or standard research and innovation, let's say, project. We know how to identify the indicators at the beginning of a research and innovation project, but now it's different. But somehow we should think on these indicators in order to measure them and then to assess the impact. So what are your suggestions from this perspective, based on the I don't know, projects already implemented or already started?
Well, as I've said, once again, when I put things down in writing, when I prepare a slide or a lecture, I tend to believe strongly in it. I believe that we need to go back, and we have started, but we need to go back to the stakeholders and to the citizens and patients who participated in the recommendations of the first Cancer Mission Board. They gave us their needs and their ideas to change and to move forward and to provide solutions. I think it's important to sit and to ask these people, these stakeholders, citizens and patients, what do you expect as an impact of the mission? What would be the indicator that will tell you that we are on the right track? For me, trying to get the citizens, and you say, and we will come later also to the stakeholders, but it's the same. All the people who believed and who participated in the mission's launching, they really expect a lot of us, from us. But we need to be able to answer their expectations in a way that they will understand. It's no use providing indicators that we usually use and that they will not understand. So I think the best way, probably not the easiest, but it needs just to be done, is to sit down with the stakeholders and say, what would you like to see as an indicator? It doesn't stop. Once again, the mission approach doesn't stop the other ways of working to continue. We've done excellent work in research innovation up to now. We mustn't change, right? But the mission concept must add something new. And I think we need to be able to have new indicators. And it's the same stakeholders who need to be asked what they want to see as indicators.
Indeed, this is something new for the mission, and I think you use the word to stimulate different stakeholders, citizens, societies, communities. And what is important is to find the best ways and tools, and maybe you might have some ideas on how to, on one side, to capture the effect of stimulating different environments, and this is different from the traditional way of looking to research and innovation. And on the other side, I think it's important, and this is based on our experience, actually, once you started to stimulate a community or citizen or stakeholders, to transform this into a continuous process. And structurally, this to be part of all the processes around this. What are your thoughts, Christine?
Well, my thoughts is a bit the same thing. Maybe I can allude it also later on to data sharing. I think the new process we've learned, and I'm very happy that in all the projects which are out, surveys and patients and stakeholders' inputs have been launched, and researchers have become used slowly, to ask the patients and the stakeholders what they want to see in the project, right? So they're used now to be able to do a survey and to ask. What they are not used to is to ask them what are the deliverables they would like to see and what are the indicators that they would like to see. So I think it's a new step that needs to be added in all research projects. Not only do we ask the patients and the citizens what they want to do in the project, but we need to ask them also what they would like to see as an indicator that would be important for them to see that we are on the right track. It's something I think that we are not still used to, right? And it's something that the citizens and the patients are not used to. But any stakeholder, I mean, you can ask, I don't know if you've done coordinations of projects of the people who are here listening to me, but when you have to write in the application what are the deliverables, the milestones, apart from the coordinator who's used to it, everybody is more or less in front of a white page, right? We know how to do research. We're happy to do it. But to try and voice what we expect and what are every 6 months something that will show that we are moving and what we call deliverable is something that is really difficult to do and to voice. And so I think not only the researchers have to learn how to do it, which is probably one of the, let's say, explanations that not all projects have a positive outcome. But if we launch citizens and patients, we probably will learn faster because they learn very fast.
Indeed, this is a challenge actually to consider the citizen and patient perspective, and to try to translate, as you mentioned, this in writing the proposal, implementing different projects and so on. And I now have a question for you as professor and a person that is coming from academia, from clinical part. How actually, because this is something new, as you said, for researchers, for academia, for clinicians to consider the citizen and patient perspective and preferences and needs and so on. We can in ECHOS project, how we can best engage with the academia and with the universities in order to use their networks and their power actually in order to have a bigger impact.
So there are universities which like to tick boxes, and universities, at least if I think about my universities in France, we have evaluations every 5 years, and we have to show that we are ticking all the boxes. And of course, involving citizens is something which has been in the remit of more than 10 years, right? And so all universities have something. Whether all teachers, professors, researchers go to these, let's say, initiatives that the university has, for me, it's no, right? So I think that the work that we need to do is to be able to help the researchers and the clinicians to be able to put it into their daily practice. And I think that's where ECHOS can be of use. We need to have standard tools, easy tools. We need, unfortunately, to have. So I was hesitating between compulsory sanctions and incentives, right? There must be a way that that at first, I'm sure that there's not only the two of us, Marius, and a few others who believe of the positive impact of listening to patients and involving citizens and patients and stakeholders, right? But people need to learn it also by themselves. And so to be able to initiate the first, let's say, integration of these actions together, there needs to be something compulsory. There needs to be a tool. There needs to be a compulsion that it needs to be done. And then there needs to be a reward for the ones who have managed to participate and to do it. They need to be rewarded. After that, I think the process will come into everybody's life, and it will be done easily and spontaneously. But to trigger the initiation, it needs to be, let's say, more or less compulsory for all EU projects, for all way that you work, to have really the citizens and the patients' outputs. I know that for the clinical research program in France from the ministry, it's compulsory now to have a chapter on the quality of life addressed in the clinical trial, right? So of course it's ticking boxes, right? It doesn't mean that it's done perfectly, but it's ticking boxes. I always use the example of the safety belt. It took a long time to have the safety belt, right? But then the safety belts were made. The cars made them more easy to put and to take off. And then there was something like a compulsory action before people believed that, in fact, it was helping their security. So I hope that ECHOS will be able to provide the tools that will be necessary to provide this interaction. And I hope that the member states will be able to make something as compulsory. Maybe we'll start with the EU projects, right? If you have a EU clinical trial, then you need to be able to answer specific requirements. It needs to be started, yes.
Thank you, Christine. I would like to go before actually asking the question put in the chat by Hugo. I would like first to discuss a bit about the stakeholders' engagement. Again, is the traditional way of looking to the stakeholders and a cancer mission driven way actually to look. And this is part of the ECHOS project and others, to look to the traditional and non-traditional stakeholders that should play a role in this. How we can actually, and it's more or less the same question as for citizens, how we can actually measure this, and especially for the stakeholders that we are identified as playing a role in the cancer mission and in the cancer overall, but they do not have like a well-established role, let's say.
So I've got two ways about it, which is something which I'm very frustrated for the moment at the way things are done. As I say, I'm old enough to say that I don't like things the way things are done now. You know, nothing's going to fall on me. I find that if you do not give the stakeholders a specific role and a specific goal to work together, then nothing's going to change, right? It's not so much giving money to the stakeholders who say that they want to participate, I don't know, in an action, right? They need to be able to know that the money that they are given is going to answer a specific question that the stakeholders have decided to be able to answer. And for this question, the stakeholders have stately written what their role would be to answer that question. If there's not a specific, for example, in France, because I've also done programming research in cancer at the national level in France, the way that the French National Cancer Institute brings together centers of excellence, for example, the last ones was in pediatrics or in translational research, the stakeholders that come together, they come together with their own specific question that they have decided to answer with their own expertise. Right? For some groups and network, it can be on inequalities. On another, it can be on I don't know, supportive care. But they are selected on their research project, and they work together to answer this project. and all of them have a specific role that they have signed for. Right? I think to be able to engage in a stakeholder in a precise, concrete way, the stakeholder needs to sign a memorandum of understanding or whatever, or a project saying that he will be doing this in this project. Right? It's not a vague idea of I will solve inequalities in around the 5 member states who are participating in this covenant. Yeah. So and the consortium needs to have a specific question that they are going to answer together. So for me, if I can really hope that being here today may eventually try and push this idea forward, which has really worked very well in France. And it's the only way that we do the work in France for bringing together specific infrastructure. There needs to be a scientific question that needs to be answered for the stakeholders to participate, right? And the stakeholders commit to this question. And therefore, that's why a lot of money is needed, right? It's difficult when you're a coordinator to be able to involve other disciplines that you find are important for your project if you cannot say, well, I can, of course, help you with a postdoc, with a machine, with funding, right? But the funding is given for the stakeholder to be able to work in the question with his expertise. It's not just the money given to the coordinator and that just increase the capacity of your center. So
maybe a short comment. Maybe a short follow-up comment before addressing the actually 2 questions coming from Hugo Suarez. Indeed, trying to activate different stakeholders for some areas, and I'm referring to social sciences, this is like Renaissance. And I'm quoting one of the famous European professors in this field, saying that, with the cancer mission and starting to work together in this field, for us as social scientists is like Renaissance. So this is, I think, really, really important in order to understand how actually can activate and have an impact. And the second part of the comment is around living labs. I actually from the beginning understood the value of this, but starting to implement a living lab looks like this should be our mindset on a daily basis, not so strict, but really, really dynamic. But this is a topic for an in-depth discussion that I hope we can have it in the ECOS webinars into the future. Now I'm coming to the Hugo's question. Hugo is from ICIB, who is the coordinator of the ECOS project. There are actually 2 provocative questions. First, and Hugo saying that, in my opinion, the vision a true European mission on cancer, or rather, is something that embedded all DGs in the Commission. And the question is, being a mission cancer so embedded in the DG RTD isn't a limitation factor for the mission?
Yes, I've thought of that, Hugo, and I've been asked the question already. So I like to have things as they're meant to be, right? The mission approach is a research and innovation approach, right? So if the mission approach is a research and innovation approach, if you're talking about the European Commission, it's in DG RTD. Right. Now, that the mission approach requires another level of governance, which has already been done in DG RTD, because it needs to link with other initiatives. And so DG RTD Mission Cancer of Secretariat as you know, has linked to EIC for calls on cancer biomarkers, has linked with Digital Europe for specific calls, has linked with calls for infrastructure. So the message of the needs and the types of research that was needed has already been done through transversal synergies. But it's something that I wanted to also to say, talking about the stakeholders and involving citizens and patients. It's the recommendation 13 of the first board, which is not only the fact that people have to understand that it's a transformation of culture, so it takes time, but it also needs increased capacity. And so to my knowledge, you cannot launch something new if you don't have somebody dedicated to help you. If you launch a project, you put a PhD student. If you launch something new, you put an engineer because he has to set up sequencing in your lab, right? You cannot set up a new concept and research and innovation at the European Commission if you do not set up a specific committee that is able to really spend 100% of their time dedicated to the mission concept, management, monitoring, and governing. So it answers more or less a bit, Hugo, your answer. I believe it has to be in DGRTD because a mission approach is research and innovation. But I strongly believe that people have to understand that it needs a specific, let's say, committee of people with new skills, time, and time to learn the new skills. I mean, once again, as I always say, when I had my research or my hospital lab, I had the same technicians, right? I did not, each time the new technology came, I did not hire somebody new, right? They trained to be able to do cell culture or genetics or isotopes, right? So it just needs times for these people to be able to dedicate to the new concept. And so this needs to be transversal and established.
Thank you, Christine. And the second question, because you actually have been from day one in the cancer mission board, is the mission on cancer meeting your personal expectation, referring to when you first joined the board? And what do you think could be done in order to improve the implementation of the cancer mission?
So if I'm still here, is that I still believe that things are working and needs to be done. What I've been saying to a lot of people is measuring the number of times now that I need to talk about the cancer mission and about what is being done, is that at least people are not now aware that the cancer mission exists. So the buzz is great. As I've said, the thing that we're missing more is time. But if I take the echo, let's say, wording, it's time to accelerate. Yes. And so the mission takes time to be established. So we mustn't, we must take it into account this time and try to shorten it. And as I've said, we need, once again, we need people like you because we as board members are only advisors and theoretically we're not meant to do, right? And so we need calls, we need consortia, we need people who would like to be able to take up the advice and the ideas of also of the Cancer Mission Board and other stakeholders to make things move faster. We cannot wait for things to be done. We have to accelerate the way that they're going to be done. And this links once again, if we measure, if we identify with the stakeholder the measures now, these measures would also push us to move faster because we would have a direction of where we need to move faster.
And we still have 1 minute from our webinar, so we have time for one last question. Looking ahead, Christine, what is actually your vision when it comes to the impact of the cancer mission, let's say for the next decade, from research perspective, from clinical practice perspective?
I think that I hope that the participation of stakeholders to answer a given question, maybe by the word living lab. As you've said at the beginning, it was important to talk about living lab because it was the way I think that could answer a way that the mission actions could move, right? So as you say, it should be standard way of working for a mission, but maybe living lab is probably needs to be kept because at least people know then more what is needed for mission actions. So that's how to get the stakeholders to work together in a living lab consortia, let's say, business plan. I think it's also something which is going to move forward in having the work package of patients and citizens, not only the last work package called dissemination and communication. I've seen some research projects where the first work package was patients and citizens, right? It will take time, but I hope that you've alluded to it today. Bringing together other disciplines is very difficult. And we do need to bring disciplines, of course, like IT, mathematicians, which are going to be important for our data. We need to have the ethics and legal, let's say, skills, and that's also complicated. But we do need also to have the patients and the citizens to participate in the research, and that's something which is still not completely embedded. So bringing new disciplines needs a lot of effort in the willingness. So once again, the incentives of getting the disciplines to work, as you've said. I mean, what is going to bring a mathematician or a human science or citizens to participate in a research project? They're going to say, what's in it for me? Right. And so to try and invite these different disciplines and to stimulate their incentives to participate in a cancer plan needs to be worked out. And it has started. So I have strong belief that all these interactions will be able to pay in the long run.
Thank you so much, Christine Chomienne, Vice Chair of the Horizon Europe Cancer Mission Board Phase 2. Thank you so much for being with us today at the ECOS webinar, our first webinar. And I would like to thank you once again for sharing with us your insights from the cancer mission beginning, start, and first phase of implementation. Of course, we are at the beginning still, but we are in the position already to identify, I may say, some good or best practices, or at least some early indicators of future success of the cancer mission. And in this landscape, our project ECHOS play, I think, an essential role in establishing not just the National Cancer Mission Hub structures, but different ways to engage with the citizens, with the stakeholders, and to build a model for the cancer mission implementation. I would like to thank you all to all the attendees as well, and to all the people that will watch our webinar on social media. So thank you once again, and have a great day.
Thank you very much. And good luck for the future.
Thank you.